Here is a 998-word overview of the requested pharmacology topics. Common prefixes, suffixes, and antidotes. Learning common prefixes and suffixes helps determine medication class and actions. Examples: prefixes: and equals against, contra equals counteract, dis faulty, abnormal, hyper equals excessive, over, hypo under, below normal, neo equals new, tachy rapid, Brady slow. Suffixes: itis inflammation, emia and producing, lysis breakdown, oma equals tumor, pathy equals disease, poiesis equals production. Antidotes reverse overdoses or toxicity like naloxone, opiates, glucagon, beta blockers, acetylcysteine, deferoxamine, iron poisoning, atropine, organophosphates, pralidoxime, nerve agents. Understanding language roots boosts comprehension of unfamiliar medications encountered. Pain management drugs. Non-opioid pain medications include NSAIDs and acetaminophen. NSAIDs, non-steroidal anti-inflammatory drugs. Reduce inflammation, improving osteoarthritis, headache, menstrual pain, but cause GI upset, ulcers, and bleeding risk. Examples are ibuprofen, Advil, naproxen, Aleve, meloxicam, Mobic. Acetaminophen, Tylenol, also eases mild, moderate pain and fever without anti-inflammatory effects or NSAID ulcer risks. Overdose damages liver. Narcotic opioid analgesics treat moderate severe pain by mimicking endorphins attaching to CNS receptors, causing euphoria, sedation, and respiratory depression. Includes morphine, oxycodone, Percocet, fentanyl, hydromorphone, codeine, and related synthetic opioids. High abuse potential necessitates careful patient screening when prescribing. Antibiotics overview. Antibiotics fight bacterial infections but have no effect on viral illness. Classes are categorized by mechanism of action and spectrum of activity against gram-positive versus negative organisms. Common groups include macrolides. Erythromycin and azithromycin treat some gram-positive, atypical pneumonias and upper respiratory infections, but limited gram-negative coverage. Tetracyclines. Doxycycline covers many gram-positive and negative bacteria, but avoidance with kids under 8 years old while teeth developing. Fluoroquinolones. Broad-spectrum antibiotics like ciprofloxacin defeat many gram-negative bacteria causing GI and GU infections, but prone to resistance patterns emerging. Aminoglycosides. IV formulations of gentamicin, tobramycin kill gram-negative organisms, but nephrotoxicity and ototoxicity risks require monitoring levels. Sulfonamides. Bactrim treats UTIs and MRSA, but about 10% of patients allergic to sulfa component causing fever and rash, requiring immediate discontinuation. Psychiatric medications. Managing psychiatric conditions involves medications from categories including antidepressants, work by increasing brain levels of serotonin, norepinephrine, or dopamine. Take 4 to 6 weeks for benefit. Classes include SSRIs, Lexapro, Zoloft, SNRIs, Effexor, atypical, Wellbutrin, and tricyclics, amitriptyline. Side effects vary. Anxiolytics. Benzodiazepines like lorazepam reduce anxiety, induce sleep, prevent seizures, but highly habit-forming, requiring close monitoring to avoid abuse. Mood stabilizers. Lithium, lamotrigine, and valproic acid preparations even out extreme emotional highs, lows, in bipolar disorder. Require regular blood level checks, given toxicity risks from narrow therapeutic window. Antipsychotics. Block dopamine pathways, improving positive psychotic symptoms like hallucinations or delusions. Include older typical antipsychotics, Haldol, with more extrapyramidal symptoms, and newer atypical agents, Zyprexa, with metabolic complication risks needing monitoring for safety. All psychotropics require tapering and no abrupt discontinuation to avoid serious withdrawal symptoms, given physical dependence risks. Beta-lactam antibiotics. Beta-lactam antibiotics share a key beta-lactam structural ring responsible for antibacterial activity. Categories include penicillins. Peninsula is the first beta-lactam antibiotic still useful against gram-positive streptococci. Methicillin-resistant Staph aureus. Prevalence limits utility, requiring addition of beta-lactamase blockers like Augmentin, combating penicillinase enzymes, destroying penicillin efficacy. Cephalosporins. 4 generations of cephalosporins provide expanded activity against many gram-positive and negative bacteria. Similar allergic cross-reactivity, around 10% of patients, as penicillin class. Carbapenems. Broadest-spectrum beta-lactams useful against multi-drug-resistant infections, but reserved for more serious indications given high cost and aiming to prevent further microbial resistance patterns from developing. All beta-lactams carry potential hypersensitivity reactions including rash, fever and diffuse inflammatory symptoms requiring prompt discontinuation and avoiding future use. Anaphylactic reactions are rare but most severe, needing rapid intervention. Insulin therapy. Managing diabetes relies on exogenous insulin therapy when pancreatic islet cells cannot produce sufficient levels. Types include rapid-acting, onset less than 15 mins, peak 30 to 90 mins, duration 3 to 5 hours. Short-acting, onset 30 to 60 mins, peak 2 to 4 hours, lasts 6 to 10 hours. Intermediate-acting, onset 1 to 2 hours, peak 4 to 10 hours, duration 10 to 16 hours. Long-acting, gradual onset, low peak, duration 20 to 36 hours. Various delivery methods exist. Injections, subcutaneous shots most common, but concentration absorption differences mean types are not interchangeable. Pump, continuous subcutaneous portable machine doses, programmed basal rates plus calculated meal boluses. Inhaled, rapid-acting insulin powder, faster onset than injections, requires special equipment. Monitoring blood glucose via fingersticks guides individual dosage adjustments per personalized regimen, developed often starting with 0.5 to 1 unit per kilogram body weight. Total daily dose benchmark for type 1 diabetics, also receiving basal, nutritional, and correction scale guidance. Chemotherapy medications. Cancer chemotherapy utilizes special medications targeting rapid cell growth, aiming to contain metastatic proliferation. Categories: alkylating agents, interfere cell duplication by cross-linking DNA strands, preventing replication. Antimetabolites, incorporate into cell-blocking normal metabolite activity. Anti-tumor antibiotics, anthracyclines like doxorubicin, intercalate DNA strands. Topoisomerase inhibitors, interrupt DNA transcription enzymes. Mitotic inhibitors, disrupt microtubule formation, preventing mitotic spindle function. Corticosteroids, lymphoma treatment, but raise blood glucose acutely. Therapy protocols combine agents attacking mechanisms synergistically. Myelosuppression, mucositis, alopecia, and infection risks require vigilant monitoring and supportive care to continue optimal dosing, destroying maximal tumor burden. Premeds prevent minimize nausea,